So I was begging for a C-section because, you know, they had the capacity to do it in that moment. I was like, something's wrong. I have a fever. I need a C-section. I'm scared. I want a C-section. Her heart rate just plummeted to 0. I want a C-section. My heart rate's at 225. I want a C-section.
That's holy crap. That's insane. My grandmother used to have heart problems and her heart rate would skyrocket to like 230, 240. And it was like one of those things where you show up to the ER and your heart rate's that high, you're the first one they see. Like the doctors come running. And the fact that you were on monitors and being watched and being supervised by a team of with resources down the hall to stop
That's what I'm saying. Yes, that's what you know what I mean, because it was a different place. Like in your home, you couldn't ask, but they were feeding you the same bullshit. Your baby's okay. Yeah. The tracings look reassuring. No, they didn't. No, they absolutely didn't. And you know, Danielle, about that video that we posted before, I was like, I can't remember if Carson's heart rate was 100% 0 and mine was that high. My sister did confirm just the other day that it was. Wow. It was that. We did remember that. Right. But it was the same way. You can do it. You're doing great. You can do it.
But
your
it
baby's
was
okay.
as long as you're strong enough. And that's the game, to know that a doctors don't play the game of, oh, you're made for this, you're strong enough, you can do it. Like that's a very midwife game. And the fact that you had a physician and a hospital that like played into that is stunning to me. But that's really like so many of the full-term birth trauma that I've heard of stems from that mentality of you're strong enough, you're made for this, you can do it. Now that you're not 35 weeks and your water broke with meconium, anything you do is the right thing to do.
And you feel like your body does something wrong because you couldn't do it.
Mm-hmm. And then afterwards you think, but I felt something was wrong. I kept asking, is something wrong? I kept thinking, is something wrong? Is something wrong with me? Is something wrong with my baby? Is something going on? What is happening? And so there's another level, like afterwards of that, when you have to like literally hit your head into a brick wall that your kid's gone and you have to go through shock, is you have to go through also that of like, I had a feeling. I felt something was wrong, but I didn't understand it.
Variations of normal are not normal.
Exactly. But I didn't understand it because I don't know what the hell I'm doing. You know what I mean? I don't know what's wrong. I'm not a medical person. I'm not a doula. I'm not a midwife. I'm not any of these people that say they know more than I do, but nobody did anything. Nothing happened. And so there's where we all tie together, is all of us had that same feeling, which the medical side of things is they may have all these tools and all these things, but they have to listen to what's being said from us. Mm-hmm. And my favorite doctors in the whole wide world will all tell you the same thing. Like of anything that they can do, of all the tests and everything, it's listening to us, listening to the mothers. If the mother has a concern, if she's questioning something, if she's asking anything, look into it. It may be nothing. It could be just fear. It could just be anxiety. It could be whatever. But most of the times it's not. And that's their experience. Is normally when a mother says something feels off, it's because something is off. Like they tell you, look for decrease in movement, increase in movement, and something feels off. We miss that third one, you know, even with your kicks and stuff like that. People are looking for decrease. People forget about increase, but then they never, ever, ever hear about if something is off, go to the hospital. If something is off, tell them. If you're in birth and you're like, something feels wrong, like it's because something's wrong. My mom had a bunch of kids and she always said, because she had a couple of situations that were really bad situations. And she said, all of a sudden I get this feeling, I can't explain it, but I got a feeling. And I was like, something's wrong. Something is wrong. And she's like, and I've had nurses and doctors tell me, no, nothing's wrong. No, something is wrong. I'm telling you, something's happening. Something is wrong. And sure enough, baby had shifted. Sure enough, something had happened that she needed right there, that they got in there, and boom, you know, the situation changed. But that's the thing, is like, if they she basically had to like almost scream in the middle of labor, something's wrong, get the doctor. Like, because she's had those moments of being dismissed in the hospital. She's always hospital births of like, it happens. This is happening. And I think that's a big part of why we kind of are fall behind, is because we don't have the information. We are being dismissed. Our voices don't feel like they're being heard. And I'm not really sure why that's happening, because it's like, and I hate to say some of it is a provider thing, because it is, you have to look for that right doctor, those right people that you can trust. And you can tell by looking at them, they're not in this for the money. They are doing this because they truly, truly care about you and every person that they see. Like, you can tell there's a thing, because like literally when you have a doctor that sits down, you're like, I don't know, like, I'm not sure if there's something going on. The doctor's like, we're doing an ultrasound and we're going to do this test. And they're just looking at you, let's do this. And they just start like doing stuff, because they know they don't want anything to happen to you. And then afterwards, you guys can, if nothing, I'm relieved. But if anything, it's like, you need that. There's where the advocate comes from. We trust them. We believe them. We go into our provider. And unfortunately, we found there's bad providers out there. And how do we find the good ones is where we're all like trying to figure it out. And then also, who do you trust? So there's so many complex things. And unfortunately, we don't have enough doctors. My OB, who's my favorite, that's right here, that's just super advocate, super just the best. She is, you want a C-section, you get a C-section. You want this, you get this. You want, what do you want? This is your birth. This is how you want it. You want, as long as it's safe, I'm going to give it to you. It's going to happen because it's your birth. You tell me anything, I'm going to check it out. Like, she's a no nonsense. When she comes in the room for 5 minutes, she's like, done. Like, literally she's like, mic drop, I'm out. Like, that's how she is. Like, Michael, when he first came into my appointments, she literally would come in and she'd be so fast. And I'd be like, I'm feeling this way. This is happening. And we're like hugging and all that. And he's like, what the hell just happened? He's like, she came in here so fast. But when she came in there, she was like, I'm going to put you on this. We're going to do this. We're going to do this, blah, blah, blah. Done. And she was like, done. She's like, I already know you. I know your history. I don't have to look at anything. And that's how she is. But we have to understand she's more of a younger, newer age doctor too. So there's also that level of, we have some of the old school ones. Now, not saying they're not bad, because some of them are amazing. Some of them are really good. They got all those years of experience and they are passing that knowledge to the newbies and stuff like that. But it's just like, we have to find those people. Well, my doctor, she's booked out. She's so well liked and so good at what she does. You can't even get in to see her, like, at all. Like, even me, I've been seeing her for years. I can't see her till probably the summertime right now. Like, it's that bad. And so I feel like, I'm like, yes, I love my doctor, but at the same time, you can't even get into your doctor because everybody loves that doctor. And there's where the crappy thing is with medical care is, you find a doctor you love and then everybody loves them because they're great and everybody knows they're great. And we need more of them. We need to clone them and have, like, we need more of them. And unfortunately, that's the problem. And then you have these other doctors that maybe they shouldn't be doctors, or maybe there shouldn't be these medical people.
So how do we get into it? So like, that's what I've been working with someone local. So how do we influence them? How do we reach the new doctors? How do we reach the new nurses, the new CNAs, the new LPNs, the new RNs, just, to put faces with the outcomes. Like, babies die. Like, it's a fact of life. Babies do die. They don't have to. Not every death is preventable. So how do we reach them about being proactive instead of reactive? And, how to lead them into having these conversations with their patients, being like, telling your patient, it's got to be a collaboration.
Something that I would say, this might seem a little bit off there, but just from my experience of having specialists, having, the maternal fetal medicine doctors, they are on a different level. Like, they're an OB. They know everything for an OB, but they know things that OBs don't know. They're beyond, and they deal with everybody. They're seeing the worst days of people's lives. They're seeing the most horrible things that could happen to people. So they're dealing with so many different things, but those people are amazing of what they do. And I almost feel like the residents, when they go with OBs and they go to all these different things and doctor in the hospital, I almost feel like they should spend some time with them like almost do a residency with the specialists that honestly, they deal with life and death every single day, because they're going, people that have genetic issues are going to them, people that, their baby's not going to make it, they're seeing like all this stuff. And guess what? They're still giving the best care. They're still taking care of and saying, how are you doing? What can I do for you? Like those are like the best doctors, because they'll cry with you. They'll hug you. They're like, I can't explain it, but those doctors are like, they're like superheroes in my mind, like honestly, of what they see and what they go through, and they take it home and they, and they come back and whatever. And they're just amazing beings. Like, and I think their job, I'm so glad, like I've been really grateful, the ones that I've had for my rainbow and for like conceiving my rainbow and for having whatever and having my last baby and all that. My specialists that I had were 2 men, which I actually pick OB females. I want a female with me because she knows what I'm going through. She gets it. And at least that's what I get in my mind. But my specialists were men, and they've been in this forever. Like, I mean, we were talking like 30 years or something. This is their life. This is what they do. And they're amazing at it. And I think that's what you would do, is you want to have somebody that's their passion. That's their life. That's their career. That's what they, you know what I mean?
Others
in it. Yes. Bringing in, and also saying,
other
how do you
professions in, like the nonprofit network that I got hooked up with isn't affiliated with my hospital. It's affiliated with one of the Catholic health hospitals around here, but pretty much anybody who has a stillbirth or a perinatal loss or anything in my area they try to get everybody sent to my therapist in some way, shape, or form. But she works in the hospital that my friend just became an RN in the NICU for. And in that hospital, the therapist is running bereavement trainings now. So all of the mother baby nurses, all of the labor and delivery nurses, and all of the NICU nurses get, as part of their onboarding with the hospital, bereavement training.
That's huge.
Which they should. They should. Everywhere.
Everywhere should, but it's so it's just not happening. So that's amazing.
The more attention we pay to the emotional needs of people, the more aware we become of the emotional needs of people, the better healthcare is going to become across the board. Because having a baby is not just a physical medical event. It is
emotional,
body, mind, and spirit. It is an adjustment across the board. And even you can take that out of the labor and delivery room and you can put it into any room in the hospital. Everybody who's in a hospital, if they're there for good reasons or bad reasons, if it's elective or it's necessary, if it's an emergency or planned, there's a whole spectrum of mental health and emotional health that also tie into the physical health. And I really do think, like, I hate doulas as they are now, but maybe hospitals should start thinking about having doulas on staff in labor and delivery. I know death doulas. Hospice is starting to hire death doulas because they're people that they're not the stretched thin nurses and doctors who are providing the medical care. They're the emotional support care for the people experiencing what's happening. And I think that's really, like, on the doctor and nurses side of things, the being more thorough, explaining things better, spending more time with your patients is going to be the real key to preventing preventable stillbirths and any kind of preventable trauma in a hospital. But integrating other fields of study into the hospital experience is how we're going to make these situations less negative across the board.
I agree. I think that's so important.
You've noticed that women get dismissed. Like we have to admit that women get dismissed all the time. Do you think it has to do with, or like we talk about pregnancy and hormones? It's kind of like she's hormonal because she's pregnant. Do you think that we get dismissed while we're pregnant or during like giving birth and labor and all this stuff because they just call us hormonal, because it's just our hormones? I never thought about it before. I kind of have before in the past, but to put the pieces together of like why are women in general being dismissed? It's because if you actually think about it, when we have our periods, oh, you're on your period. Oh,
Hysteria.
It's like, there's like a thing, right? About like your feelings and your feelings. We're going to dismiss your feelings. We're going to dismiss what's going on with your body. But isn't that all part of what's going on? Your hormones, which they're dismissing, is how you go into labor, right? That's what they do.
It's
with
a
induction.
physiological response.
Exactly. So if you don't have those hormones, you don't go into labor. So like, if you think about it, we're being dismissed for the things that our body needs in order to go into labor and have the baby to begin with. Like, it just popped in my head right now where I was like thinking about it, I'm like, I think we're being dismissed over hormones.
But that's across the board. And I think it's like,
yeah,
like
women
when
get
you're
a bad rap.
pregnant. And